My Lords, I rise to speak to my Amendment 38 and declare my health interest in the Register, particularly as a trustee for the Centre for Mental Health and an honorary fellow of the Royal College of Speech and Language Therapists. This amendment is short and simple. As the explanatory statement makes clear, it merely adds to the list of requirements for membership of an integrated care board and must be included in the ICB Constitution. I believe it is essential to have a representative of mental health trusts for each ICB area, and therefore on the ICB board, as it is the key strategic body for, amongst other things, healthcare commissioning, planning priorities and resource allocation for a local area. The broad context of my amendment is to ensure that what progress has been made, and there has been progress, regarding the concept of parity of esteem between mental and physical health, and crucially the allocation of resources to mental health is not lost in the new structure of the integrated care boards. We have already had some powerful and compelling debate around the concept of parity of esteem, which I'll not repeat today, but suffice it to say that through this bill we must not lose the fact that Section 1 of the Health and Social Care Act 2012 enshrined in law equivalent duties on the Secretary of State for Health in relation to the improvement of physical and mental health services. And that since 2013, the NHS Constitution in England has contained a commitment, and I quote, to improve, prevent, diagnose and treat both physical and mental health problems with equal regard. Obviously, this overall context is much broader than my amendment, but has and will form the backdrop to many of our debates in the coming weeks. However, as a crucial step and to secure the commitments to mental health services are honoured, we must ensure the most appropriate and relevant membership of integrated, and I stress integrated, care boards. That is why I obviously also support other amendments in this group, particularly Amendment 37 in the name of my noble friend Baroness Thornton and others, in which Section D mirrors my amendment, but also includes, as we have heard, directors of public health and social care providers. They must be included. And Amendment 39 proposes an expert in learning disabilities and autism, which I strongly support, and I look forward for that amendment being moved by Baroness Hollis, who I have tremendous respect for. This amendment also must be accepted. And further, I've added my name specifically to Baroness Finlay's Amendment 40 to include allied health professionals, and I give a particular mention to speech and language therapists, who with other allied health professions will continue to play an important role as the government has recognised in delivering the NHS long-term plan. All of these bodies are critical parts of delivering along the various pathways for mental health services, from early intervention and prevention to the most specialised care, and include the interface with the criminal justice system, such as liaison and diversion services. It is essential, therefore, that each of these bodies and others have a seat at the board table, and that specifically mental health trusts, as my amendment proposes, are statutorily included. If we take my own home area, Greater Manchester, as an example, there are essentially 3 mental health provider trusts covering the ICB area. I'm sure they could agree who should serve on the board and ensure that the interests of mental health services are heard loud and clear. Without their voice, there is a real danger that the very powerful interests of acute trusts, principally delivering physical health services, will dominate the agenda, so possibly undermining commitments on palliative esteem and skewing decisions on resource allocations, both revenue and capital, away from investment in local mental health services. Now, the Minister may suggest that such prescription is not required, or that guidance will be sufficient to persuade ICBs to include mental health trusts on their board. And I have no doubt that the Chair-designate of Greater Manchester, Sir Richard Lees, fully understands the imperative to include them on the board. But I do not think this is good enough. This requirement must be underpinned by statute. Otherwise, there could be a real lack of consistency across the 42 ICB areas, which could undermine equality of access to mental health services and further limit transparency and accountability to local people of the decisions that will be taken on their behalf in respect of their mental health and well-being. I feel sure the Government will recognise this and look forward to a positive response, not only to my Amendment 38, but to other amendments in this group that are aimed to protect the interests of mental health services across the country.
My Lords, it's a pleasure to follow the Noble Lord Bradley, and I support those amendments with respect to mental health. My amendment